Hey, y'all, Earl Stephenson Jr. here, your Atlanta board certified plastic surgeon. And I am back. I've been away for a little bit and hope that you have been looking for me and have missed me a little bit because I missed you and I wanted to continue to give you the truth and transformation. I want to give you a little bit of a PSA. I want you to take a break. I want you to listen to it. I want you ladies to especially listen to it and share it. Please, this is important. When I was sitting down today, just kind of chopping it up with my staff, we got on a discussion about compression garments or Fajas. And one of my staff members was telling me about a friend of hers who had surgery and was really stressing about the compression garment. Oh, it's too loose, it's too loose, it's too loose, it's too loose. I think clients, women, because a lot of women have aesthetic surgery for body contouring, whether that's liposuction or tummy tuck or fat grafting or BBL, they are accustomed to, and I think it's standard practice to get a compression garment after surgery. But ladies, you wear yourselves out concerning yourself about the compression garment, thinking that the compression garment is going to make the result. That's at least what I hear and understand from my view, that you think the compression garment really dictates the final result. It does not. Let me just say that again. It does not. It's helpful, but it's not the end all and be all. So, what I want to do for a few minutes, just bear with me before you get in a tizzy and get mad at me. Just bear with me. Listen to my 4 C's of compression. The first three are going to be why I think compression is beneficial. The last C is why I think you should not use or have the mindset of using compression. So let's start off with, of course, number one. Number one, C of compression garments or fajas is obviously compression. So why do you want compression? Right after surgery, whether it's liposuction or tummy tuck, we kind of disconnect the skin from the underlying muscles. And that skin sometimes can move right after surgery and create a lot of friction. And that friction creates fluid. That fluid can be troublesome or problematic. The technical or medical name for that fluid is seroma. It's just a clear fluid from the lymphatic drainage, which is normal. Our lymph system kind of soaks that up minute by minute, even as we sit with surgery or without surgery. And we're none the wiser. But after surgery, the lymphatic system is disrupted, so fluid can collect, and that's why we use drains and do other things and use compression so that we close down spaces so fluid can't form, and we keep the skin somewhat still or allow it to minimally move so it doesn't produce fluid. So compression garments are great for that. The second C that is useful in compression garments or fajas is comfort. It allows a little restriction in the movement and gives you support so you feel confident, and that with normal movement, it is not agonizing. So it does provide comfort. So that's the second C. That's why I think it's beneficial. The third C is contour. So it does help contour. It minimizes swelling and kind of controls it. It does not really shape, in my opinion and in my experience, but it controls swelling, which then adds to comfort and adds to the compression. So those 3 C's, compression, comfort, and contour, are important, and it's why I use compression garments and fajas. And I usually use them for about 6 weeks or so. Beyond 6 weeks, maybe to 8, let's push it, you get no benefit of compression, no benefit of contour. I'll say that. And mild benefit from comfort from a compression garment. The compression garment does not dictate the final result. The surgical execution and plan dictate the final result. The result is going to be what it's going to be at a certain point in time, at 3 months or 6 months, whether you have compression or whether you do not have compression. So keep that in mind. So again, we talked about the 3 C's. So I mentioned fourth. The fourth C is the C that I don't like. And this was where everybody gets spun around and in tears because the compression garment is cumbersome and they can't breathe and it hurts and so on and so forth. It is not a corset. It is not a corset. I'm going to say that one more time. It is not meant to corset you so that you can't breathe. It's restrictive because if it applies too much pressure to the skin that's been lifted up, suctioned underneath, stretched, and stitched, it can damage or cut off the circulation that the skin needs so desperately in the healing period. And if it does that, then it can end up in a wound at the incision or anywhere where it cuts off that circulation. And you end up with a problem or a huge problem, depending on where that wound develops. So you don't want to strangle the skin. You do not want to strangle the skin. So stop corseting yourself into misery. Don't do it. Stop it.